Hey friends, coming to you live from sunny Scottsdale, Arizona. I'm in my bedroom sitting on the floor because I like sitting on the floor. Anyway, today we're talking more about iodine. And yes, it's pronounced iodine. More on that in a little bit. So, back in the early 1900s, it was actually discovered that iodine deficiency was causing goiter, which is an enlargement of the thyroid gland. And you see people with these bulbous necks. And to correct this and address this epidemic health concern, the US government started supplementing it in the diet of Americans by iodizing table salt. And as you know, Americans, we love our salt, so people are getting more, and this really helped prevent goiter. But the iodized table salt was only enough to prevent goiter. It wasn't enough to create iodine sufficiency in the body. So as a result, we're seeing a lot more issues with that. And the information I'm referencing today is actually from an amazingly thorough article written by Don Bennett. You can get it on his website, health101.org. I will link in the description. And it's really well researched, really thorough and very clear, and I highly recommend that if you have thyroid problems or if you're doing iodine therapy, interested in doing iodine therapy, that you go ahead and educate yourself and read his article because it's really awesome. But yeah, that's what I'm referencing, and so bear with me as I flip through pages because I printed it out old school. Anyway, there are two different forms of iodine and iodide. The difference is one electron, and some tissues of the body concentrate iodine and some concentrate iodide. So we need both forms. So if you're going to supplement with iodine, you want to make sure it's iodine and iodide. Now, a little bit more on the connection between iodine and thyroid health is, as many of you know, if you've ever gotten a thyroid panel done, you often get thyroid hormones T3 and T4 drawn. And the 3 and the 4 in T3 and T4 actually stands for the atoms of iodine. So iodine accounts for 59% of the molecular weight of T3 and 65% of the molecular weight of T4. So iodine literally composes part of your T3 and T4 thyroid hormones. So obviously we need it in order to have a healthy thyroid. So if you're having thyroid problems and you're getting your thyroid panel done, you might as well ask for an iodine test as well. You can easily get a blood test, but the best kind of test is actually a different kind, which I'll talk about in a future video. So some of the symptoms of low thyroid function include weight gain, slow metabolism, fatigue, dry, brittle hair loss, constipation, mental fog, brain fog, poor circulation, aching joints, and feeling cold all the time. Iodine is one of the 5 elements known as halogens, and the other halogens are fluorine, bromine, chlorine, and astatine. So this is why we say iodine, not iodine. Hope that makes sense now. And the other halogens are also really important to the body's ability to utilize iodine, especially bromine. And when I started doing my iodine therapy, I actually had some bromine detox symptoms. We'll talk about that more later on too. The sister group to the halogens are the halides, so iodide being one of them. So we need sufficient iodine to prevent the deficiency disease of goiter, but we also need sufficient iodine for the thyroid to create enough hormones for proper hormonal balance so as to prevent both hypo and hyperthyroid, and for normal basal metabolic rate so that you can maintain your ideal weight and be lean and healthy with lots of energy. We need iodine for proper brain development, to fight infections, protect from and deal with cancer, for healthy skin, to prevent fibrocystic breast disease and mental impairment as we age. Every single cell of the body has an iodine receptor, and this is what it does for us. It supports apoptosis, programmed cell death, which prevents cancer. It's involved in ATP, energy production and management. It prevents premature fatigue. It helps to prevent insulin irregularities. It supports protein synthesis. It destroys pathogens, molds, fungi, and parasites. It helps excrete toxic halogens and heavy metals. It regulates estrogen production and helps prevent polycystic ovarian disease. It helps prevent heart disease. It affects IQ all throughout life. It supports pregnancy. It's needed for healthy nails, hair, teeth, and bones. It's required to achieve and maintain your ideal weight. It's helpful in preventing cancer of the breast, colon, lungs, ovaries, pancreas, prostate, stomach, and thyroid. So many different kinds of cancer. Actually, some doctors are also using iodine, see, I did it there, in the treatment of children with Down syndrome and autism, as well as people with Parkinson's disease. So, as you can see, it's really, really important for healthy brain development and healthy psychological and mental functioning. So that's what I'll share for today. I've got a lot more to share, but that's a lot of information. If you like this video, please like it. Please subscribe if you want to stay tuned for more information. And also check out the links in the description below. There are links to my blog, my Instagram, Facebook. I'm always sharing recipes, inspiration, and hopefully information that can help you achieve greater levels of health and happiness. There's also a link to my free recipe ebook in the description, 45 sweet, low-fat, raw vegan recipes with recommendations to customize them according to your Ayurveda dosha. So really, really awesome book. You can get it for free or pay if you want to. And yeah, that's all in the description below. So I hope you have a wonderful day. Please take care of yourself. The world needs you to be the very best version of yourself that you can be. Thanks for watching. I'll see you soon.